ಅದನ್ನೇ ಕೇಳಿದೆ. ನಾವು ಮಾತಾಡಿದ್ಮೇಲೆ ಒಂದು ಪಾಸ್ ಇಲ್ಲ, ಚೆನ್ನಾಗಿದೆ, ಕ್ಲಿಯರ್ ಆಗಿದೆ ವಾಯ್ಸ್.
ಇನ್ನೊಬ್ರು ಜಾಯ್ನ್ ಆದ್ರು ನೋಡಿ,
ಯಾರು ಅವ್ರು ಮಾತಾಡಿದ್ರು? ರಾಜಶ್ರೀ ಅವರು ಅನುರಾಧ ಮೇಡಮ್ ಕಡೆಯಿಂದ ಬಂದಿದ್ದಾರೆ.
ಓಕೆ.
ಸಾಯಿರಾಮ್ ಕೆ ಯಾರಿದು? ಸಾಯಿರಾಮ್ ಅಂತ ಹಾಕಿರೋದು ಯಾರು ನಮ್ಮಲ್ಲಿ? ಮಮತಾ ಬಂದಿಲ್ಲ
ಮೇಡಮ್. ಶುರು ಮಾಡ್ಬೋದಲ್ವಾ?
ಎಸ್, 9 ಆಯ್ತಲ್ಲ.
9 ಆಯ್ತು.
ರಾವತ್ कैसे हो?
Dr. Amrita, you can take it over. You can start the session. Yes. Please start.
Start madam sir.
Yes.
Yes ma'am. Video ilbamma Amrita.
Ma'am, on ಇದೆ ma'am. Good evening everyone. Welcome to Vaidya Sammilana 23 organized by Tribhuvan Holistic Health Foundation, Bengaluru. I am Dr. Amrita Vai, Assistant Professor at Sri Paripurna Sanatana Ayurveda College, Department of Kaya Chikitsa. I'll be your moderator for the night. Our topic for this evening is cervical cancer, public health burden and the advances in prevention. Before we begin, a couple of points. Please mute your microphone so we don't have any background noise during this session. If you have any questions during this session, feel free to type them into the chat box. We'll answer them during the Q&A session later. So let us start our session by seeking divine blessings. I invite Dr. Gayatri, PG scholar from Sri Jayendra Saraswati Ayurveda Medical College, Chennai, to deliver the invocation. Dr. Gayatri, please go ahead.
मैत्री भजतः अखिल हृजेत्री, मैत्री भजतः अखिल हृजेत्री, आत्मवदेव परामर्ति पश्यत, आत्मवदेव परामर्ति पश्यत, युद्धं त्यजत स्पर्धां त्यजत, युद्धं त्यजत स्पर्धां त्यजत, त्यजत परेश्वर क्रममाक्रमणम्, त्यजत परेश्वर क्रममाक्रमणम्, मैत्री भजतः अखिल हृजेत्री, मैत्री भजतः अखिल हृजेत्री, जननी पृथ्वी कामदुगास्ते, जननी पृथ्वी कामदुगास्ते, जनको देवा सकल दयाळु, जनको देवा सकल दयाळु, दाम्यतदत्त दयत्वं जनतां, दाम्यतदत्त दयत्वं जनतां, श्रेयो भूयात् सकल जनानां, 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 नमामि धन्वन्तरिमादिदेवम्, सुरासुरैर्वन्दितपादपद्मम्, लोके जरारुग्भयमृत्युनाशम्, धातारमीशं विविधौषधीनाम्, ॐ शान्ति शान्ति शान्तिः। समस्तलोका सुखिनो भवन्तु, समस्तलोका सुखिनो भवन्तु समस्तलोका सुखिनो भवन्तु.
Thank you, Dr. Gayatri, for the beautiful start to our session. Now, to officially welcome everyone and tell us a bit about the vision of our foundation, I invite Dr. G.S. Gopal Krishna sir. He is the Secretary of the Tribhuvan Holistic Health Foundation, Chairman of AFMC Chitradurga, formal principal of Sri Raghavendra Ayurveda Medical College and Ashwini Ayurveda Medical College. Welcome, sir.
Hari Om Namaste. I am Dr. Gopala Krishna, Secretary of Tribhuvan Holistic Health Foundation. Very immensely pleased to welcome you all to this Vaidya Sammilana. At the outset, let me welcome Dr. K.S. Jayashree, the President of Tribhuvan Holistic Health Foundation, and also today's speaker, Dr. Anuradha, for the session. Tribhuvan Holistic Health Foundation, which was founded 3 decades back with a motto to enable the fraternity to understand the scientific sutras of samhitas practically, as well as giving more understanding, deeply understanding into the siddhantas. To understand this, we are doing the Shastra Chintana, Dravya Chintana, Symposia, and all seminars, and also Vaidya Sammilana, and many such activities. Another activity of the Tribhuvan Holistic Health Foundation is to identify and honor the silent servants of the society, may it be the academicians, the teachers, and the Ayurveda practitioners, and also the meritorious students who excel in their study. Even every year, we are giving a gold medal in the RGHS to encourage the students to go into the depth of study of the Ayurveda. We also conduct hands-on the workshops to make them understand the concepts of Ayurveda, put them into the service. Serving the society is the main motto, enabling every practitioner, every student, every academician to go into the depth of the subject to serve the society is the motto. Loka samasta sukhino bhavantu. Namaste.
Thank you, sir, for your warm words of welcome and for providing us with a profound overview of the initiatives led by Tribhuvan Holistic Health Foundation. To introduce our keynote speaker for the scientific session today, I call upon Dr. Chandrakala, Professor in the Department of Roga Nidana at Sushruta Ayurveda Medical College, Bengaluru. Ma'am, over to you.
Thank you. Om Dhanvantre Namaha. I am highly privileged to introduce today's guest speaker, Dr. Anuradha Paramesh. She is the Proprietrix at Anuradha Women and Ortho Day Clinic, Sanjay Nagara, Bengaluru, practicing there since 4 decades. Presently, State Coordinator for IMA HPV Vaccination Awareness Program, member of IMA Standing Committee for MSN, that is Medical Student Network, Socio-Cultural Committee, CWC member, that is Capital's Women Care, EC member for FSS and FFPI, that is Fertility Sparing Surgery, Federation of Family Physician Association India, EC member, Chairman IMA KSB Membership Drive Committee and also Building Committee, EC member for CSEPI Karnataka, that is Council of Sex Education and Parenthood, and also Federation of Family Physician Association India. She is the EC member for both the committees, and affiliation to member of IMA, Indian Medical Association, BSOG, that is Bangalore Society of Obstetrics and Gynecology, IMS, International Menopausal Society, FPAB, Family Planning Association, RO, Red Cross Society, delivered talks on women's health, conducted school health and adult health programs through FOGCI, chaired and co-chaired many scientific sessions of IMA BSOG and FPAB and seminars of other societies. Past, she was a president of IMA Bangalore Branch and vice president of IMA Karnataka State Branch. In 2025, she has bagged 4 awards: FFPI President Appreciation Award, that is again Federation of Family Physicians Association, IMA KSB President Appreciation Award at Medicon 2025, IMA Bangalore Branch Woman Achiever Award in May 2025, IMA HQ AKN Sinha National Award at NatCon 2025, token of gratitude from IMA MSN, that is Medical Student Network at NatCon 2025, special interest prevention and early detection of cervical and breast cancer and chronic diseases like hypertension, diabetes and osteoporosis. Very passionate about the well-being of our professional colleagues. Welcome you, ma'am. Thank you.
Thank you, ma'am. Moving on to the main part of our session, Dr. Anuradha Paramesh, ma'am, over to you. Please unmute yourself.
Yeah. Good evening, everyone. The audience as well as the organizers, all of you all are new to me. Can you hear me?
Yes, ma'am, you're audible.
Madam, you are loud and clear.
Okay. So sincere thanks. Pardon? You're able to hear me?
Yes, ma'am.
Yes, you are loud and clear, madam. Please continue.
Yes,
madam.
Sincere thanks to FPA Bangalore chapter for giving me an opportunity to speak to this august audience about a very passionate subject of mine. I'm very passionate in prevention of any disease, for that matter, preventable diseases. And certainly we all know that cancer cervix is one such opportunity for us through HPV vaccination. And I would like to speak a few words about FPA, Family Planning Association of India, before we move on to this main topic. Well, we know very well that India was overpopulated when we got our independence, and so came the existence of FPA in 1949 by Her Greatness Srimati Avabai Wadia Ji. And this was included in the first 5-year plan, and MTP Act in 1971 was introduced. Injectable contraceptives came into existence in 2015, and the association has 44 locations across 17 states. Sir, next slide. Yes. What are the areas that the association focuses on? One is gender equality and advocacy, sexuality education, maternal, child and adolescent health, and sexually transmitted infection prevention, and subfertility, as well as gender-based violence, which we all know very well. That prevention also the focus is on. And what is the vision of FPA in this 5-year plan period is between 2023 and 28 is strengthen the sexual and reproductive health and rights, as well as social well-being. And missions include gender justice and inclusion, and it also focuses on marginalized communities. Bangalore chapter was established in 1955, so 70 plus years in sexual and reproductive health, works with Karnataka government and National Family Welfare Program. It has about 24 staffs, 2 satellite clinics with 5 outreach units, and 38 project locations are there. And what are the services rendered by FPA? There are many, and as we all know, now the focus is on the last service that FPA provides, and that is cervical screening. So we now move on to this chapter, this particular topic. Thank you. So Kaushik will start running the slides. So sincere thanks to the Government of India officials for helping me to share the slides that they have prepared. And as we all know very well, our Prime Minister has introduced free HPV vaccination, and he has launched it on 28th of February for a 3-month period. That means to say March, April, May. This month end, this 3-month project is getting over, and during this 3-month period, about 80,000 vaccines have been already given to various health centers. And the bitter truth is only 20,000 of the doses have been utilized. That means three-fourths of the vaccines are still lying, the cold chain being well maintained by the government in all the health centers. So it is our bound duty as doctors to transmit the information. And unless and until I, as a doctor, don't know much about the vaccine, why it is used, etc., I may not be that effective in passing on the information to not only my professional colleagues, to also the public at large. So here, uh, the government, the Ministry of Health and Family Welfare has prepared wonderful slides. So I didn't feel like changing any of them. So we are lucky that we are going to get first-hand information of what our government is doing. And simultaneously, I shall also add extra points with respect to cervical cancer prevention. We are talking about prevention. Mind you, it is prevention. We don't want to diagnose any woman with cervical cancer. And the only answer for this is the vaccination. So it has been proved beyond doubt that HPV vaccination is the only remedy for taking care of all our women, because we all know that every 9 minutes in India, a woman is being lost. We are losing a woman, mind you, at the prime of their age. Women, most of them between 35 to 45, they are diagnosed with cervical cancer. As we all know, it is diagnosed late because the symptoms are very, very negligible. And even if they have some, our women take longer because they're too busy taking care of their family members. Husband is building his career, she is building a career now, simultaneously taking care of the kids. What happens? They tend to ignore smaller symptoms. So we are diagnosing them late, and every 9 minutes we are all losing a woman. So this has to ring the bell for all of us, that we have to make very sincere attempt amidst our very busy schedule, busy practice or non-practice time, to devote a few minutes to speak about this vaccination, HPV vaccination. So what are the frequently asked questions, and how are we going to go about knowing more about the vaccine? Next slide. So we are going to understand cervical cancer and how HPV viral infection causes cervical cancer. Next slide. Cervical cancer, as we all know very well, we know what is cervix. The lower part of the uterus has two parts. The lower part, lower 1/3 is called the cervix, and at the mouth of the cervix is where this particular dreaded disease starts. So it starts at the lower end of the uterus, that is the cervix. And 99.7% of all these cancers, it has been proved beyond doubt that it is caused by a viral infection, and that virus is human papilloma virus. Most of the time, not most of the time, almost all of us get bear this virus with us. The body is able to take care of the viral infection, and the body fights, and we are symptom free. But we are bothered about something more about this particular HPV viral infection. What is that so special? When the body is able to fight it out and we are going to be almost symptom free, what happens? There are two important things that we all need to know. In human papilloma viral infection, there is something called persistence of the infection, and there is something called the oncogenic strains. So almost 200 types of HPV viral infection happens, and amongst them the dangerous oncogenic strains, the strains which cause cervical cancer, is what we are all concerned with. And the second thing is persistence. The body has got enough of immunity to fight away this infection, but some of these viral infections persist. If the non-oncogenic strains are still there, nothing is going to happen in the vagina, in the cervical region. But if this oncogenic strain, if it is the dangerous strain, that is when it is going to create problems for us. So we need to now work on two things. One is persisting infection, Another one is the oncogenic strains. So how are we going to catch it? I wouldn't like to postpone telling these key answers to you all. So how are you going to detect this persistent infection? How are you going to catch these oncogenic strains? It is a simple HPV pap smear. WHO recommended HPV pap smear done every 5 years. You're going to pick up whether this virus is there or not. If the virus is persisting, what do you want to know? You want to know whether it is the oncogenic strain or the non-oncogenic strain. And if it is the oncogenic strain, from pap smear, we move on to colposcopy. There in colposcopy, we confirm whether the virus is caused any damage to the epithelial cells which are there at the mouth of the uterus, that is at the cervical region. So I have given all the answers to you all. That we are speaking about HPV vaccine to prevent cervical cancer. And if at all somebody refuses to take the vaccine, or we have older women who are not who may or may not take the vaccine, because our gynec society, the Federation of Gyne Obstetrics Pan India, recommends the vaccine up to 45 years. And the catch-up vaccine for us starts from 15 to 26 for boys and 15 to 45 for girls and women. So 9 to 14 is what we are all speaking. But as I speak about this, I would like to deviate a little by speaking like this so that the doubts get clarified then and there. So the previous slide. Oh, yes, the next one. Yes. So what are the signs and symptoms? Early stage, nothing. You don't even know that the HPV virus is there. Let it be there because the body is capable of managing. But if it continues to lurk around and if it is the oncogenic strain, then we are in trouble. What happens? The woman presents with vaginal bleeding. It is, mind you, much later after sexual intercourse. It may be watery, bloody vaginal discharge, foul smelly, foul odor. That foul comes very, very late. And unhealthy appearance on examination. That means to say a woman after delivery almost never turns up back to the doctor. She comes back with her daughter-in-law for pregnancy checkup or her daughter for pregnancy checkup. But she comes only if she has some symptoms. So if at all she comes to us for a pap smear, that unhealthy cervix can be picked up. If she refuses, she says, I don't have money to get a HPV pap smear done, a speculum examination will be able to pick up that this unhealthy cervix. And when you feel there is problem, you have other simpler tests. We will speak about it. So signs and symptoms of more advanced cervical cancers is all these things, seeing the frank growth and having pelvic pain. All this is too late. It is almost in the 4th stage, not even in the 3rd stage of cervical cancer. Next. What is the burden of cervical cancer? It is the 2nd leading cancer amongst women. And which is the 1st leading cancer in women? Now it is breast cancer. And with respect to breast cancer, I would like to say a few words because I wouldn't miss out, because my every consultation covers self breast examination and speaking about breast cancer, and also about pap smear vaccination followed by pap smear. So to say a few points about breast cancer, self breast examination needs to be taught to every woman. I do breast examination because every month, say on the 5th of every month, because I am still not started menstruation. This is for small girls. For those girls who are having periods, they have to do self breast examination 1 week after every period. Those women who have attained menopause, those who don't have menstruation, they pick up one date in a month, say 10th or 11th or some particular date, and they do self breast examination. This is not only the breast, it is also the axilla. So these 4 regions need to be examined: right breast, right axilla; left breast, left axilla. And if at all you find any pain or something different, you have to report to your doctor. So first leading cancer cause in women, all of us take the responsibility of picking up early. Now, the second one, as we all now know, is about cervical cancer. So, almost 80,000 cases are being detected, and 34 deaths are happening because of cervical cancer. Mind you, it is 2022 statistics. 2025, no, we don't know the latest. But I feel very happy because of this HPV program that we conducted from Foxy and IMA. Almost all of us in IMA, we are thoroughly well versed, and vaccination is being done left and right by every other doctor. So that same thing needs to happen in your community, in your doctor community also. So the incidence has been 11.6 per lakh women years. Mortality is 5 per 1 lakh women years. Next slide. What is HPV? It belongs to papilloma viridae. It is a DNA virus, double-stranded, and I already mentioned that more than 200 types are there. And currently, the oncogenic strains, the high-risk strains, which we pick up with pap smear, are the 17 HPV types, namely 16, 18, 45, 33, 58, 31, 52, 35, 59, all of them. But amongst all these 17 types, we are only concerned about these 4 types, which cause warts as well as cervical cancer. Most of the cervical cancers are caused by these, but we have others also causing. And as of now, the vaccine that is available covers only these types only. That means to say, even if she has taken the vaccine, she has to undergo the pap smear because the vaccine covers only few oncogenic strains. So 16, 18, 31, 33 are being taken care by the vaccine, and some more with the nonavalent strain. And 16 and 18 together are responsible for 77% cases of cervical cancer and 83% of cervical cancer in India. So what is the infection? It is a sexually transmitted infection. And when we speak to our patients, it's better we not unnecessarily speak about sexually transmitted infection. The moment we open our mouth, we are in trouble. All that we have to say is, look, your child had DPT polio, BCG vaccination, and her or his next vaccination is due at 10 years for the booster TT dose, TD dose, and at 9 years, 1 year back, now a new vaccine has been introduced, and your child, both boys and girls, need the vaccine. All that you and me will say is, there is the recommendation. This recommendation says your child is 9 years old, so he or she, both boys and girls, is due for this vaccine. We shouldn't unnecessarily open conversation about sexual transmission because we know very well, particularly we gynecs, almost every other woman who walks into your clinic is sexually active. So there's no need for her, when she comes with a missed period, to ask whether she's sexually active. You can blindly do the test. That is the scenario in this decade of my practice. So initial 2 to 3 decades, whenever I had any doubt, I used to find it difficult to ask this question. Even before you ask the question, our women will say, yes, I am sexually active. She's very open to it. So what happens is, this is a sexually transmitted infection. Most of the infections are asymptomatic. I spoke about it. And what another very good important message that I need to tell is, apart from cervical cancer, this particular vaccine also takes care of other cancers. So somebody asks you a question, you can start telling, not only because cervical cancer is only for women. My boy, why should my boy take? So that was that is their expression. So even before they ask a question, for example, when I was counseling that boy, a lady to get her son vaccinated, I said cervical cancer means, suddenly the next question arises. So immediately what I said was, even before she could ask me a question, was, this particular vaccine not only takes care of cervical cancer in women, it also takes care of oral cancers, anal cancer, penile cancers, and then in women, vulval vaginal cancers, cervical cancer also. That means to say, this is a vaccine which is common to both men and women. Though we know fully well that our focus is only cervical cancer. Yes, it's going to take care of other cancers, but we are concerned with only cervical cancer. Mind you, both boys and girls harbor this HPV viri. Next slide. How does the infection spread? Well, between sexual partners, and it is it is presumed to be communicable during both acute and persistent infection. That means to say, initial sexual intercourse also this infection happens, and persistence also exists in this. And it is through intimate skin to skin genital contact, including vaginal, anal, as well as oral sex. Next slide. Can it be passed from a mother to her child? Yes. It is rare, but it can happen. Next slide. And what is the incubation period? We spoke about warts as well as we spoke about cervical cancer. The warts, it takes about a few weeks to manifest. So they come with symptoms, and we are happy to treat and make sure that the vaccine is also given. But with respect to the cancer, it takes decade, 10 years, 15 years, 20 years for the infection to happen. So cervical we are very lucky because there is such a long incubation period. So we pick them up in the precancerous stage through HPV pap smear. Of course, we have the cytology to pick up if there is any damage which has occurred because of the infection. Next slide. Is there an immune response after natural HPV infection? Yes, there is, but it is not that adequate, not that much as when you give the vaccine. So it is expected of us to vaccinate them because natural immunity, it is not adequate for the viri to be taken care, particularly the oncogenic strains. So HPV vaccine is an important cancer prevention tool, and the serological response after the vaccination is stronger than after a natural infection, providing people with a strong long-term immune protection to the viri. Next slide. How to diagnose invasive cancer? I think this slide is just for the sake of completion. We know very well, you do a scan, you do a let me go from step by step. You do a per speculum examination to see the cervix, then you get the scan done. If the abdomen scan is inadequate, we get a cervical scan done. Then we go for CT scan, MRI, PET scan, etc. Mind you, this should not be in our dictionary. Our dictionary, advanced cervical cancer, we don't want to see any of them because we have already done the pap smear for those who still didn't get the vaccination done. Next. What is a global strategy that is being adopted for eliminating cervical cancer? We'll come to India also. So the global WHO strategy is, we want to end this cervical cancer by 2030 in India. So what is the message? What is the message for us from WHO is, follow the 90-70-90 strategy. What is the first strategy? 90, what does it mean? We must make sure that 90% of our girls and boys are vaccinated. And then at least 70% of our women will have this HPV pap smear. And by default, if the third step, by default, if they miss out on these two and they land up with the with the cancer, with the malignancy, cervical malignancy, we have to give the best of the best care. So our focus should be on the first step. 90-70-90, we'll have to focus on 90. So we are very happy that our Prime Minister has yielded, and our doctors, our people have succeeded in recommending the vaccine to be there free of cost for all girls. Mind you, any girl who is 14 years, her mother or she herself has to log into UWIN portal, enter her details, and the nearest center will be indicated there. She can go to the nearest center and get the vaccination done. Another step, I don't know how to log in and I don't know what to do. Go into any center. They will enter the details in the portal and the vaccination will be given. Let's suppose there is no power and the internet is not working, whatever may be the reason, even then the vaccine cannot be refused. As during COVID times, we used to go give our ID cards, get the vaccination. Here also the same thing is followed. Mind you, keep in mind that 75% of the vaccine in Karnataka is still lying in the cold chain in all our health centers, and we are failing in pushing our girls to the health centers. To push our girls to our health, we should not push them to the health centers. They should ask and run to us. They should come and ask us, what should I do? I should take the vaccine. And for that, the answer is each and every one of us who have logged in today, we have to carry that message that it is mandatory for every girl and boy to take the vaccine at 9 years. If your girl or boy doesn't belong to 14 to 15, you come to our private centers, at our private clinics and hospitals, you pay and take the vaccine. If she is belonging to this age group, only she, not even the boys, they take the vaccine free of cost. Now, continuously every day the vaccine is being given. Once 31st May is gone, from 1st of June, it will be given only once a week according to the immunization schedule, and they take it there. But I think before that, we should make sure that we have a collar up with a higher percentage acceptability of this vaccine. Next slide. Why does the global strategy recommend the vaccine? The priority purpose of the vaccination is to prevent cervical cancer, which accounts for 82% of all HPV related cancers, because the vaccine doesn't cover 100% all the oncogenic strains, and hence this terminology is there. So we shouldn't unnecessarily tell our patients only some oncogenic strains are covered, so you should have pap smear. So we shouldn't go to the depth at all. You just say that this vaccine is recommended, kindly take it. And later, when you counsel, you bring them for the HPV pap smears. So preventing cervical cancer is best achieved through immunizing girls before they get sexually active. So some people will say, my girl is not yet married, sexual intercourse will start later. Mother doesn't know that she's already sexually active. So we are not bothered about all their personal problems, or we wouldn't want to intrude into all that. All that we say is, why do you give DPT? Why does your child get vaccination? Because to prevent some infection even before it occurs. Similarly here, the girl has to have the vaccine much earlier, and all the trials, clinical trials have uh, well, they have good recommendation that it can be started at 9 years of age. So it is estimated that implementing this strategy could prevent 6 crore cervical cancer cases and 4.5 crore deaths, women deaths, in the next 100 years. Next slide. So now we come to all about the vaccine. So the risk of cervical cancer can be reduced by giving timely HPV vaccination and cervical screening, which we discussed at depth. So this vaccine primarily prevents cancer caused by 16 and 18, which accounts for 83% of the cancer cases in India. And how does the vaccine work? Is it a live vaccine or is it a attenuated vaccine? Well, it has virus-like particles, VLP. Like any other vaccine, it triggers the immune response, creates antibodies. You get good antibody titers, which will protect against future infection by specific cancer-causing HPV types. Does the vaccine provide herd effect, herd protection, indirect vaccine effect? Yes. Like how we made sure that we went around giving polio drops to every other child, because we wanted herd immunity, so that the cross protection happens even if some of them are left out from taking this vaccine. Similar to polio drops, you are able to succeed in providing herd immunity, and that is why we are focusing on widespread usage of this vaccine. So in between, somebody takes one dose and then doesn't come back with the second dose. I'll speak about multiple doses and single dose. Government is recommending single dose. Are we just because some of our doctors are thinking government has now come out with one dose, subsequently based on other XYZ reasons, government will give the second dose. No, the government does not plan to give the second dose. This particular vaccine, what they are now giving, is going to be a single dose, and all those girls who take the vaccine need not have to take the second dose. Why? There are many reasons to justify that this dose is enough. Only problem for us is we from Foxy, from IMA, from government, from CTG, we have not got any instructions to reduce the dose to one dose. So we in private, we are all continuing to give the 2 doses before 15 years and 3 doses after 15 years. But once we get recommendation from Foxy, from the Gynec Society, or from the CTGI, we also will switch over to whatever recommendation they give. So government will continue to give single dose, and in private, I'm not justified in giving single dose because what I have been directed to do, I continue to do it. And you are justified in giving single dose only in government centers. That vaccine is not available anywhere else, and none of us is authenticated to give the vaccine. I have to go and take the vaccine there only in the center. That vaccine is not circulated to any of our private institutions. Okay, so when the vaccine leads to a herd effect as per the evidence, when there is good coverage of the vaccine, it is going to give a herd effect. Herd immunity is going to happen, and there is evidence of indirect protection of unvaccinated females through herd effects. So the unvaccinated females are also going to be covered by this, but this part is only for our academic information. I don't think we need to speak about it. Only thing is we need to know that we are working on providing herd immunity, just as how we have eradicated polio. We'll also have to work out on eliminating cancer. So I think most of us are already aware that some countries have already eliminated CS cervix. Australia is one such country. They were on a war footing, not now, decades back. We are on a war footing. So hopefully by 2030, we'll be able to, if at all we move seriously in the way it is expected of us. Achieving 80% girls coverage of the vaccine is going to reduce the risk of HPV infection in boys also. Herd immunity is going to be effective there. And that's one of the reasons why the government has recommended this single dose. Next slide. Does the vaccine provide lifelong protection against cervical cancer? Yes. There is no recommendation for a booster dose. Analysis of a large multi-center prospective cohort study comparing 1 dose, 2 dose, and 3 dose regimens of the quadrivalent vaccines in females between 10 and 18 against 16-18 infections was high for a median follow-up of 12 years post-vaccination for all schedules. So post-vaccination, this particular study has happened for 12 years after the vaccine. Gardasil, another trial, is up to 26 years after the vaccination. And our government vaccine, I think they have put it as 10 years post-vaccination. The study has shown that it is not needed. The booster dose is not required. Next. How long does it take for the antibodies to occur? Yes, almost 4 weeks enough after the antibody titers start showing up. Next slide. What are the vaccines available in India? The slide shows Cervarix, the bivalent vaccine. All of us know very well, during the COVID days, this vaccine was withdrawn from the company. We no more have the Cervarix bivalent vaccine. Now the vaccine that is available is Gardasil, quadrivalent, Gardasil Nano, the monovalent vaccine, and the Cervavac from Serum Institute. That is also quadrivalent vaccine. Next. So which type of HPV infection can be prevented by the quadrivalent vaccine? The high risk types 16, 18, 6 and 11. 6 and 11 cause genital warts, HPV related cancers. The quadrivalent vaccine covers 16, 18, which cause almost more than 80% of the cervical cancers caused by 16 and 18. Does the next slide. Does the vaccine prevent all types of cancer? No. This is for our academic information. We should not pass it on to the patients because they will get confused. So what we need to know is it primarily prevents cancers caused by the high risk types only, especially 16 and 18, which accounts for 83% of cervical cancers in India. Next slide. Can the vaccine treat HPV infections or HPV related cancers? No. Whatever infection has happened, that needs to be taken with pap smear and colposcopy. And whatever cancer they develop, what stage the cancer is diagnosed, accordingly we treat it. Whether it is chemo followed by surgical removal, or whether it is straight away, a very early stage, go for surgical removal of the uterus, or is it that only radiotherapy has to be taken, or is it that it is too advanced that we have to go on for palliative therapy? So it cannot treat the already existing cancer, already existing infection. So we'll have to move a step back to prevent occurring of the infection. Next slide. Is a vaccine a live vaccine? No. It has virus-like particles and it is a non-live recombinant vaccine and it cannot cause HPV infection. HPV virus-like particles are there in this vaccine. Next slide. What preservative? Doesn't have any preservative. Next slide. Eligibility and vaccine timing. How do you give the vaccine? Which age group is eligible for the vaccination? So under the Government of India guidelines, girls aged 14 years, those who have already celebrated their 14th birthday and they are yet to celebrate the 15th birthday, they are eligible for the vaccine. So once the Aadhaar card shows that the girl is 15 years, then the vaccine cannot be given by the Government of India. I think Dr. Rajeshri is medical officer in the Greater Bangalore. So she will tell us whether if the girl by default is a little above 15 years, whether they really give or not. So that answer she's going to give. But the recommendation is 14 to 15. Due to limited global supply of this vaccine, India is initially focusing on vaccinating a single dose, that is 14-year-old girls, to make sure that they don't cross the upper limit of 15 years. We have to work on it. Next. Why are only girls being vaccinated? Achieving over 80% coverage in girls will reduce the risk of HPV infection. Herd immunity is going to happen. The boys are also going to be indirectly covered. So we private practitioners, let us not depend only on this 14 to 15-year-old girls. Why? The youngsters, they have to wait so long to take the injection vaccine, and the older people, we cannot ignore them. We'll have to do either give the vaccine. For older women, we should start doing the pap smears. So NTAGI and WHO position paper has recommended that the vaccination is the tool for preventing cervical cancer and recommended for girls. They are the primary target, the 14 to 15-year-old girls, because after analyzing all this, the government, the group of doctors who came up with the recommendation finally came to this, because we have to cover all these. So there are about 5.03 lakh girls in Karnataka between 14 to 15. 80 out of 80,000 doses, 20,000 only. So we have to make sure that the rest of the girls are taken care. Even the rich and poor, whoever it is, let them take the vaccine at the center. And when you enter in the UWIN portal, let's suppose that particular girl has already taken the vaccine. You tick mark there. So that information is also goes for our statistics to Government of India. So it's those who have taken the vaccine also can log in and do this. Next slide. Can adolescent girls who have celebrated the 15th birthday receive the vaccine? Under the Government of India guidelines, girls between 14 to 15 are being given. Those who have celebrated their 14th birthday yet to celebrate the 15th birthday, this is only for the Government of India health centers. Next slide. Why isn't the vaccine recommended for older adults? In the sense that it is not the free vaccine that is being given by Government of India. Vaccine is most effective and durable when given at a younger age, ideally before exposure to the virus, before their sexual debut. As people get older, the chances of prior HPV exposure increases, making the vaccine less effective. So younger the age, more effective is the vaccine. Next slide. Why is the vaccine introduced in a campaign mode? The vaccine is currently being introduced through this very special campaign launched by our Prime Minister on 28th of February is to ensure that trained health workers with proper cold storage, mind you, proper cold storage is very important. And if at all you say whether cold storage is good in a private or government, so I point my fingers and say government. Stringent measures are taken to see that cold chain is not disturbed. What is that cold chain? To put it in simpler words, they are transported in ice box and directly transferred to the fridge, and they make sure that the fridge the power is not off, and all those things are well taken care in our government centers, not let alone HPV, the new vaccine. Every other vaccine is available, I think only except a few, the children that they are able to get all the vaccines free of cost at our centers. So trained health workers are needed, proper cold storage needs to be maintained, and close safety monitoring has to be done. All that is well taken care, and our personnel in the health department are overworking and making sure, and they were trying to pick up loopholes so that we don't fall short of utilizing this free vaccination for our 14-year-old girls. So this careful rollout helps to build a strong foundation before it becomes part of the routine immunization schedule. Next slide. What is the dose, schedule, efficacy, and protection? Next slide. So the dose, this quadrivalent vaccine, it is a 0.5 ml intramuscular vaccine given in the left upper arm for all 14-year-old girls. And Government of India has chosen a single dose vaccine instead of 2 to 3 doses schedule, because this offers whatever efficacy this vaccine single dose offers, it has comparable efficacy and duration of protection to a 2-dose schedule. Few countries, about 4 countries have done a single dose the trial, and Costa Rica, Kenya, India, and Tanzania, and they have confirmed that this single dose vaccine is adequate. Next slide. Why is Government of India using Gardasil 4 vaccine instead of Gardasil Nano in its HPV vaccination campaign? It's not just the cost. You need to know little more about it. The primary objective of the vaccination is to prevent cervical cancer, which accounts for 82% of all HPV-related cancers in women. And this provides protection against 6, 11, 16, and 18. But Gardasil 9 is able to cover some more types. There are 6, 11, 16, 18, 31, 33, 45, 52, and 58. What is that? Message that the Government of India wants to give is, despite the broader protection by Gardasil 9, HPV 16, 18 alone are contributing to 83% of cancers. So most of the cancers, not 75%, it is 83% of the cancers are caused by this. And as of now, the vaccine that is available is able to heed to the 83% of the crowd. What about the other 17%? Do we have an answer for that? Yes. What is the answer? We do a pap smear. Simple. So you do a 5-yearly pap smear. And thus, by focusing on the high-risk strains, the government strategy is a highly effective approach to reduce the overall disease burden in our country. Next slide. Does the quadrivalent vaccine provide cross protection for types in monovalent? Yes. The quadrivalent vaccine provides partial cross protection against these HPV types which are not included in this vaccine. Next slide. How effective are these vaccines? This answer we all need to know by heart. 93 to 100% these vaccines are going to prevent cervical cancer. They are highly immunogenic. The natural infection, the immunity that is developed is inadequate, and that is why the infection persists. And we are not bothered about all the 200 types of HPV virus. We are only bothered about the oncogenic strains which cause this cancer. So the serological response to this vaccination is much stronger than the response after natural infection. I add one more point. Younger the girl or boy is, higher is the antibody response, greater is the immunity that they develop. And so we need to stress on the 9-year-old boys and girls in our private practice, and we also going to utilize the 14-year-old girls for the government free vaccine. Next. Is a single dose effective? Currently, one dose of the vaccine in young girls is effective and provides sufficient protection against persistent HPV infection. So on our behalf, the government has themselves, they have only prepared the slide saying that even the Gardasil Nano and Cervarix we are not using because it's not available at all. Post-COVID, the vaccine is not at all there. So they are referring only to Gardasil 4 and Gardasil 9. So what our government officials are saying is they are effective as a single dose. So if any of our patients take one dose, unofficially we can call it a day. Or unofficially, because still these we get instructions. I don't think as private practitioners, at least I don't have the courage. Next slide. What is the duration of protection against this quadrivalent HPV vaccine single dose? This message we have to take because we are answerable. When somebody asks, you are giving 3 doses, you recommended 2 doses, now suddenly government you say 1 dose. For a single dose schedule, the antibody titers have been shown to be stable for over 10 years, and the follow-up studies are ongoing. There is no evidence to suggest that a booster dose is needed after primary HPV vaccination. So the trial as of now for the single dose that is being given at the government level is for 10 years. Subsequently, in the next few years, we are going to get more data on that. Next slide. Vaccine safety, yes, it's 100% safe. Or as with all vaccines, the usual safety effectiveness monitoring we have to do. Studies have demonstrated the safety and effectiveness of the vaccine already. And since licensure in 2016, 50 crore doses of the vaccine have already been distributed. Mind you, this is data in 2022. So now the coverage would have been much more. That means so many doses we have already given. Post-licensure surveillance has detected no serious safety issues to date, except rare reports of anaphylaxis. Almost in my practice, since 2009, I'm giving the vaccine. Not even pain I have noticed in any of my patients. Next slide. Is it safe to vaccinate a girl during menstruation? Yes. Menstruation has nothing to do with her daily schedule. If she has unbearable pain or she has heavy bleeding, we treat. Otherwise, it is another day, normal day for her, particularly if she's already started using the menstrual cups. These menstrual cups can be recommended even for girls who are not sexually active, who are not married. They are very, very user friendly. First, I have to learn. After I learn, I need to transmit it to my patients. Yes, it is safe during menstruation. Next slide. Will the vaccine affect a girl's fertility? Certainly no. In fact, if by default, while being treated for infertility, and if there is any problem, then the treatment will be delayed or disrupted. So that problem will not be there. So it's better we vaccinate all of them. But will it affect our chances of getting pregnancy later? No. The vaccine has no impact neither on fertility or her future pregnancies. During pregnancy, we don't give the vaccine. Will the vaccination affect? Okay. Can the vaccine be given during pregnancy? No. We don't have trials. We haven't conducted any trials giving vaccine to pregnant women. So we say by chance she took the vaccine and that particular month she has a missed period and pregnancy is positive, she can continue the pregnancy. There is no need to terminate the pregnancy. And what will you do with the other doses? They are given after delivery. So in 16 RCT trials, including more than 25,000 participants, no specific safety concerns were identified for the outcome of pregnancy, spontaneous abortion, miscarriage, stillbirth, or fetal development. So, but still, we do not recommend the vaccine during pregnancy. If it is given and then she has a missed period, we can relax. We need not have to worry at all. Next slide. Can the vaccine be given while breastfeeding? Yes. It is safe while breastfeeding. The vaccines given to lactating women do not affect the safety of breastfeeding for mothers or the infants. So post-delivery, you can start the vaccination. Next. Can the vaccine be co-administered with other vaccines? Yes. Like how other attenuated vaccines are given, similarly, this vaccine can be combined with the other vaccines like TD-MR or Japanese encephalitis vaccine. Next slide. Can the individuals known to be immunocompromised or with HIV infection be administered the vaccine? Yes, certainly. Even if the girl or boy is in the 9 to 14 years age, and if by chance they are HIV positive, if they are immunocompromised, you are justified in giving not 2 doses, recommended 2 doses, but 3 doses. So in these immunocompromised category, we need to give 3 doses instead of the recommended regular 2 doses. So individuals known to be immunocompromised or infected with HIV can be given 2 doses. So single dose has jumped to 2 doses from the government recommendation. So what I have learned is we have been giving 2 doses for 9 to 14. We are going to make it 3 doses. That's it. Next slide. Does the family history of cervical cancer affect a girl's eligibility for the HPV vaccine? No. Family history of cervical cancer does not affect the girl's eligibility for the vaccine. Everyone has to take it. Next. What are the contraindications? A girl with moderate severe illness, she's having fever. Certainly we shouldn't give, isn't it? Because if anything happens, the fingers point towards the vaccine only. Yesterday the fever was less. Today after you gave the vaccine, the fever has increased. So it's always better not to think about any vaccine for that matter when they come with any illness. So those who had allergic reaction to another vaccine previously or they are known to be allergic to yeast, they should be avoided. This vaccination should not be given. Pregnancy we avoid. Girls out of the target age group range under the current HPV vaccination program. That means if the girl is not 14 to 18, the vaccine is contraindicated because the system does not enter their names at all. The system refuses to give it because the system has been fed to be given only to 14 to 15. Previously vaccinated, what does the system do? If already the girl has received the vaccine, the vaccination status needs to be updated in the UWIN portal. Next slide. Special situations. Should the vaccine be given to eligible girl visiting from other states? Anywhere in India, the girl needs to be given the vaccine. If she has to bring her ID card to make sure that she belongs to that age group. Without her Aadhaar card, we cannot give the vaccine. And if the system, we have any issues also, we are going to give the vaccine. Next slide. I've already overshot the time. Can the vaccine be given to transgender people? Yes. Next. Do women need to be screened for cervical cancer? No. Cervical cancer screening, pap smear is separate, vaccination is separate. So even if they have received the HPV vaccine or and they still need regular screening for cervical cancer. Why? Because 9 years the girl was supposed to take the vaccine before her sexual debut. She has taken the vaccine much later. That's one point. Second thing is, not all the oncogenic strains are covered by the vaccine that is presently available. So it is our duty to make sure that we never misguide our patients. Next slide. Can someone with abnormal pap smear results take the vaccine? This is a very important message. Suppose you do a HPV pap smear and it turns out to be HPV positive with the oncogenic strain. She needs to be given the vaccine. Why? There are so many oncogenic strains. She is positive only to this, but for her protection against other oncogenic strains, she needs to take the vaccine. So pap smear positive, you still give the vaccine. And you treat the abnormality, whatever it is. Next slide. I'm already exposed to HPV infection. Can I take the vaccine? You may not know that you're already exposed to HPV unless it is established by a pap smear diagnosis. If you or any visual inspection with acetic acid, VIL, etc. If you are in the recommended age, you are encouraged to take the vaccine, though it may not halt the progress of the disease due to already existing HPV exposure from the sexual activity. You need to take the vaccine. Next. I've already taken the vaccine. Can I still get HPV infection or cervical cancer? Yes. Even if you have received the vaccine, you still can get HPV infection or cervical cancer caused by the non-vaccine types of virus. This is only for our academic interest and for our discussions. This particular message, we don't have to carry it on to our patients. Like how when you counsel a patient for a surgery, you speak about all the complications. And do you still withhold operating? You have to operate. Similarly is the case here. We need not have to unnecessarily speak about this particular part. This is for our information. Next slide. We're almost done. Does the vaccine protect against genital warts? Yes. Quadrivalent vaccine does protect against 6 and 11 strains which cause genital warts. Genital warts is treatable. Next slide. If an eligible girl is already given a licensed HPV vaccine in a private sector and parents insist for the quadrivalent dose again under the campaign, what do? The government recommendation is single dose. She's already vaccinated in private, so you cannot touch them. So no, as per the Government of India guidelines, any girl who has already received a HPV vaccine cannot be given this quadrivalent vaccine that is which is being used in the campaign now. If it is confirmed that she is vaccinated with one dose, you have to enter in the UWIN portal and move on. Next slide. An eligible girl at the HPV vaccination session claims that she doubts she is already vaccinated against HPV in a private sector. What should we do? Obviously, we'll have to give medical officer will try to ascertain the fact that she is vaccinated. If there is no evidence, you have to vaccinate them. Next slide. What if we vaccinate an eligible girl with the quadrivalent vaccine in the campaign and later parents disclose that she was already vaccinated? We just move on. We need not have to worry. If in case by default she was already given the vaccine, you gave it again, there is no harm at all and the girl will still be protected from the infection. Next slide. What if a girl misses her dose of vaccine during the HPV vaccination program? What will we do is we'll put her into that weekly vaccination date. So she will have to go on that particular day when the vaccination is being given. So the girls or the parents should report to the medical officer or contact ASHA workers or ANM workers of that area and visit the facility for getting the vaccination on that particular weekday. That is after this campaign. Whether the campaign will be extended or not, we don't know. As of now, 31st May, up to 31st May, every day the vaccine is being given. Next slide. What is the purpose of obtaining informed consent after administering the vaccine? As per the new Digital Personal Data Protection Act, personal data of any individual, including minors, cannot be collected or processed without the consent of the individual. And the new Act of 2023 mandates informed consent to ensure the beneficiary understands the benefits and potential risks of vaccination and agrees voluntarily to take it. So she is a minor, less than 18 years. So consent of the parent is required. Without signature, we cannot give the vaccine. About that, Dr. Rajeshri will clarify. Next slide. What to do in case of non-availability of eligible ID card? I just now said, if there is any issue, it will be taken care, but we will make sure that the 14-year girl takes the vaccination and walks out of the health center. Next. What should the vaccinator do if a girl is brought to the health facility, but there is no internet connectivity? You're still going to check, enter manually and give the vaccine. Next slide. Can private hospitals be engaged in for HPV vaccination under UIP? No. As of now, under UIP, only government health facilities are giving the single dose regime. So they continue to give it at their centers. So we cannot, we private people cannot give it. We have to go and take the vaccine there, only there in the health centers. I think, Kaushik, this is the last slide. Thank you one and all for a patient hearing. Hope I have given adequate information, but kindly check the chat box if in case I have answered queries. Thank you. Yeah.
Thank you, ma'am. So you have made clear presentation with all the details, whatever questions might have come. So the questions were asked about the no history of cancer. Still, why should they take the vaccination? And if they have complication, as you already have mentioned about it, maybe is there is one question can be that there is no family history of cancer, just still take the vaccination. Maybe you can answer that, ma'am.
By virtue of being human beings, by virtue of being either a girl or a boy or a transgender, you are carrying the HPV virus. Everybody is carrying the HPV virus. You may be lucky to have non-oncogenic strains, and you may be lucky with good immunity, your body is going to fight away all that. But if in case you're carrying the oncogenic strains, not necessarily family history of cancer, every person has to take the vaccine.
Yes, ma'am. That answers the question. Side effect complications are definitely addressed. So if there are any more questions, you can please go and post the questions in the chat box. There are a few, for any vaccination for that matter, many of the practitioners, many of the public also think like the vaccines can tend to cause, as it happened in the COVID situation also, that they cause some problems like maybe blood clots, whatever. It can be possible, doubt they don't prefer giving vaccination. What is your
Yes. I have not presented the slides which clearly the analysis has gone for almost 26 years from the manufacturers of Gardasil vaccine MSD. 26 years, up to 26 years after giving the vaccine, the trials for each and every side effect, whether it is thromboembolism or whether it is local pain, fever, name anything, all those trials have not picked up any of these issues. And you can, with the big history of the trial, we can comfortably go ahead and give the vaccine. One precaution that you and me have to take is any injection for that matter, you You have to make the patient wait, stay for about half an hour, let the patient be around, let them not stand and take the vaccine. Let them sit and take the vaccine or let them lie down and take the vaccine. And we all know very well, all vaccines, we need to give it in the deltoid region. So I think those primary things we need to do.
Thank you, ma'am. There are
Dr.
no more
Rajeshri?
questions asked.
Yes, sir.
Yeah.
Dr. Rajeshri, as a medical officer, I would like her to tell us exactly what they are doing at the health centers, because this is from the horse's mouth. She's going to give us
Yeah.
live information.
Yeah, thank you very much, Madam Dr. Anuradha Paramesh. Good evening, everybody. Yeah, being in GBA as a medical officer, I'm very proud to say that our government of India and the Prime Minister have launched this single dose HPV vaccine from February 28th of this year. Unfortunately, that was a time when all the children of 14 years, they were going through this preparatory exams or final exams. So most of the schools, they were reluctant to get the children exposed to the vaccination. And basically, schools are the only place where we get to come in contact with the children. And it went on, and now almost after February, March 28 came and April 28, now summer holidays are going on. So now, as per the schedule, it is only till 28th of May. Probably upon some request, they may or may not continue this daily schedule. But this is a golden opportunity for all 14-year-old girls to come every day. We know the value because our immunization schedules are only on Thursdays. We only immunize children on Thursdays, not any other day, even if they come from different places, whatever be the condition. They have to come only on Thursdays and in particular timing. That UWIN portal will be open only in that time. So this is a golden time for us to make the 14-year-old children to get the vaccination. One more thing, we entirely depend on the Aadhaar card. We entirely depend on the Aadhaar card for the age of the child. See, the child probably has entered a wrong date in the Aadhaar, and she may be a little less than 14 or she may be a little more than 14 as per the words of the parents. But we cannot refuse the injection because as per Aadhaar, she is 14 years. She would not have completed 15th birthday. So we entirely depend on Aadhaar card. Whatever date they have given, as per the Aadhaar, if she has completed 14th birthday, not come to her 15th birthday, she is eligible for the vaccination. And one more thing is, if they don't have an Aadhaar card, they will definitely have mother card, Thai card it's called. So that we usually tell them to bring it till 15th year. 15th year, we give the last TD in the immunization schedule. So all mothers have been educated from the time of the child's birth to keep the Thai card until the complete immunization schedule. So 14th year comes within that. So they can as well bring the Thai card. So rest all the questions Madam has already covered. The unfortunate thing is the target was like 1.25 lakhs. And rest of the Karnataka has at least picked up quite well. But our Bengaluru urban is lagging behind drastically. It was just 5% a few weeks ago. And because of so much of pushing, we go to schools, we go to different communities, and we are trying to give lot of awareness. Now it is slightly picked up, but it is not up to the mark still. So now we are trying to collect the information from schools. I mean, in which schools they are not willing for the vaccination, because we don't come straight face to face with the parents in schools also. The only way we can pass a message is give awareness to the children. They go home and talk to the parents, and then they have to come back. Lot of obstacles are there, but still we are trying our best by doing community awareness programs. We go to schools and give lot of awareness. One more thing is we are sending our ASHA workers, health inspecting officers to each and every house in our ward and checking if there are any girls who are 14-year-old before 15 years. They'll bring the list of the children and we persuade them. We tell them, till now we have been, not a single girl has refused vaccination, and not a single girl till now under this government program has got any reactions. All are well, all are fine. And whomever we have persuaded, they have come and thank you, madam. They have come and got the injections done. But still the target has not, we have not reached the target. That is the only problem. And still there is time. Schools are getting reopened by 21st May, I think. Once it is started, we can always give awareness, more and more awareness, and persuade them to get, because this is an excellent golden opportunity for all the children. And after 28th of May, we don't know, they may extend, they may not extend. And as madam said, maybe weekly immunization may include HPV also. That we are, till now, this is the schedule. Till 28th of May, it is definitely there. Daily we are vaccinated. Yeah, and as madam said, our UPHCs and all health centers are well equipped with ILR, that is ice lining refrigeration, where strictly the viability of the vaccines are maintained. Even if we have to go outreach, means we go out and give the vaccines, there are that exact time limits is given to the staff who goes. Within that time limit, she has to come back and put the vaccine in the ILR. Yeah, that should cover the entire. Madam has covered everything possible under this government program, and also beyond that, what we can do in private sector. Thank you, madam.
Thank you. Thank you. Thank you, Dr. Rajesh.
Thank you, ma'am, for your valuable insights.
Sorry for overshooting. I don't know. Spoke too long, I think.
Sir, shall I proceed with the vote of thanks?
No. I will have Dr. Jayashree madam address. After that, we'll see. Ma'am, mute there.
Ma'am, please unmute yourself.
So at the outset, I thank you very much, Madam Dr. Anuradha.
Thank you.
For your very detailed, no, of course, slides are there, but your additional inputs are really, really highly, educative and also motivational. And what you say in Kannada, we say kalakali. That concern you express is extraordinary. That is Bhutadayam Prati Karuna. That is the most important for every doctor should have. That's very well expressed in your words. So we could feel it. And it was really for our Ayurvedic practitioners, was really an eye-opener. Because we may be knowing that's all, but not in this depth. So that was really helpful for us. And you also told about the limitations of the vaccine, because the different strains which may not have that, antibodies could not be developed, and they could have a chance, but still it is very minimal. So that is very interesting, really. And a few words to say about our science, because Ayurveda is claimed to be a preventive science. Even our Prime Minister says that it is for prevention mainly. But of course, we cannot compete with the vaccine because we haven't developed such type of vaccines. But we have a threefold approach for prevention, like Nidana Parivarjana, that is avoidance of etiological factors. Then Shodhana, this is a specialty of Ayurveda, where we prepare the body in such a way that the antibodies will be supported because the body becomes more stronger. And cleansing at the cellular level. That is the Shodhana and Panchakarma, what we carry out. The second type of modality we adopt. And the third one is Vedic Kshamatva. Now, balancing or improvising the immunity. This is again, we have Janmaja, Kalaja, by birth the child may have, and then the Kalaja, the time, as you said, 14 and 15, this is the prime time to give, before the exposure to sexual relationships. Then comes the Yuktikrita. So for the vaccination, what you are giving comes under Yuktikrita, and we plan and execute it. And under Nidana Parivarjana, when we say, it is the parental rights which also speaks about. Because there are about 3 to 11% of cancers which could be caused not because of vaccinal, the strains HPA, but it could be because of the individual's, weak point, what you say. We use the word kavai gundida. So the care of the individual, the prevention, any prevention starts before the individual is born. That is how Ayurveda starts from there. Even the couple, when they want to plan and expand their family, the couple are treated for 1 month or 3 months based on the requirement. They are subjected to this Shodhana and other Rasayana, etc., wherein the seeds, the primary seeds for conception are very healthy. So from there it starts. So if you are talking about Nidana Parivarjana, like it could be a genetic factor, which could be a reason for a manifestation of this cancer. So that could be prevented to a certain extent, because that particular pregnancy becomes more healthy. Because you have prepared the couple for that. So from there it starts. And of course, Ayurveda is known for the lifestyle. As you said, every time you must go for a pap smear. The monitoring is very, very essential, even in spite of vaccination. Because after vaccination, of course, you forget it. That's all. That ends the matter. Only some problem comes, then you can go. But it is not so here. There should be a periodical, methodical and periodical monitoring, like pap smear screening and such other things, because we are not sure about the strains. So that spirit could be treated with our, we call it as rasayanas, which can take care of the cells and cell behavior. Cell behavior is the one important factor, which is the reason for manifestation of malignancies. So from there it goes. Further, the prakriti, the personal traits of the person. Of course, nowadays, a lot of researches have been done on Ayurgenomics, which speaks about the path through which the disease could be manifested based on the constitution of the individual. So that alteration of the epigenetics could happen only when there is the lifestyle modification. Non-judicial practices, or could be an addiction, could be a habit which is not suitable for this, which could be oncogenic. And nowadays, even the foods, the prepared foods what we are taking, there are a lot of chemicals which could be carcinogenic. Or these could be prevented, and periodical shodhana, the purificatory processes what we want to adopt, definitely removes them. So in that way, we can make the individual much more stronger and much more healthier to combat, even if there is some other oncogenic factors and oncogenic strains. That, of course, we have not done the studies, but this is what Ayurveda speaks about. But there are a lot of researches going on nowadays on herbs. But actually, when you talk of Ayurveda, it should be the whole treatment, whole approach. All types of money. It could be local, or it could be general, or it could be preventive, or it could be therapeutic, like that. But usually what happens in research is they take one of the drug, like on turmeric they have done on send lines, and on ashwagandha, a well-known drug again, proven. And also we have this panchavalkala, that is 5 barks have been used in combination for local treatment. An oil is prepared and used, and that has given a very good thing, but the study is not at the larger rate. So the clinical trials yet to be done. And you know very well, we are not given the primary cases. Once it is diagnosed, they are not given to us. Because when we wanted to take up cervical cancer long back, about 20 years back from Kidwai, we were given only terminal cases, recurrent cases, non-responsive cases. So initial cases, as per the protocol, they have to treat those, so they denied giving that fresh cases. In that also, the survival rate, and the tumor growth reduction were really noted, but that was a small study. I feel now we are coming together. It's a beginning. So if we be together, plan together, that becomes a beginning. Working together will be a success. So I think we should go hand in hand. I request all our Ayurveda practitioners present here, and also the practitioners of modern medicine, your friends or Dr. Rajlakshmi, like people, to consider this also. Apart from depending on only on vaccination, we can think of this also. because every time you are giving, you have to do the pap smear. So it is not the end of it. So we have to take care of the individual as a whole. A holistic approach, I think we can definitely succeed. So this was an eye-opener session, and we can work together because we have colleges. In this group, we have a number of academicians who are also PG guides. So they can take a smaller one under your guidance, a collaborative work. Later on, we can go for the extramural projects wherein we can do it at a larger thing. So this is what I feel. It was a very good session where we could interact very well. And thank you very much. Thank you, the organizers. Thank you.
Thank you,
so
madam.
much.
Yes, now that Jayashree madam spoke about what in your Ayurveda, what you could do for HPV infection as well as cancer, I did get to know your way of treating. And in my apart from my practice, apart from the family medicine practice and the gynec practice that I have in my clinic, now I'm devoting my time also for the allopathy doctors, that is the IMA doctors. There I keep telling everyone that you should avoid cross specialty treatment. I say, if you are a cardiologist, don't treat somebody with white discharge. If somebody comes with a scan report, pregnancy scan report, you do not comment on it. That doctor would say that there is less of liquor and we should not misguide them. So similarly, when it comes to crosspathy, what I suggest is I shouldn't be treating Ayurveda medicines because I haven't studied about it. So similarly, for your colleagues who use English medicine, who come to our hospitals, what do you suggest and how? See, if at all you and me have to work, our allopathy doctors will not allow me to work with you. Or maybe I, as a representative for allopathy, wouldn't. Because cross speciality is one thing that is bothering. But I keep telling in every other session. Yesterday, when I spoke, also I said, when I was speaking, Dr. Rajeshri, I had gone to which medical college? Where was I yesterday? Ambedkar Medical College. I said, no, you stick to your specialty. In IMA, all specialties will sit and discuss. You know what I am doing. I know what you are doing you are a pediatrician, so I know as a pediatrician what you are doing. You are a gynecologist, I know what you are doing. But I will not put my hand in. That is what I say. Now, Madam Jayashree, what else you and me could do so that we can work hand in hand? Because you know very well that people, old timers like me, because I'm already into 14 years of practice, I'm practicing community medicine thoroughly. I don't send any patient out without telling them what else they should do. Like, for example, turmeric or whatever it is, ashwagandha, all those things we do speak. But to prescribe Ayurveda medicine, I'm not the authority because I haven't learned about it. So, what is your, what can make us work together?
Actually, see, we cannot monitor because the modern science has advanced so well. Because we cannot wait till the disease is manifested because we don't want them to have the diagnosis done. Before that, only we should do. So that part we cannot do because our detection part is not so much developed as you have done. So,
yes, got it.
So you will be monitoring and we'll sit and discuss, of course, what is the best one, safest one, proven one. Such simple remedial measures, we can definitely start. Like, even a douche. Instead of giving only plain water, warm water or salt water douche, we have different kashayas which are really acting, really helpful, especially in cervical hyperplasia and such conditions. So, monitoring should be from your side. And because all researchers, you have already a standard protocol, we cannot do, even if we do and say that claim will not be accepted globally. So, to have that protocol, we need your guidance. And wherever possible,
how are we going to work together? Because
that's what
I have to carry some message.
It could be an add-on therapy, or it could be a supportive therapy. That we'll have to decide. So to begin with, we can have a pilot studies in the PG units, and then we can plan for a larger scale one.
I got it. I got the
Yeah.
message, what
Yeah.
you're trying to tell.
Yes.
But what I'm asking Dr. Neelkant or Dr. Manjula or Dr. Jayashree is, you know very well, suppose I refer a patient, the patient will not come back to me. Is a concern, isn't it, Dr. Rajeshri?
No, madam. When we jointly work, I don't think this will happen.
No, doctor. We don't keep the patients. What
No,
we
I'm not.
do is,
No.
whatever
I'm not-
possible from our side, we tell them these are the things to be done. Go back to your doctor and tell that this is what we have advised and follow that.
Madam,
That
there
time
are
we
a
will have
lot
enough.
of ethical problems. But what I am suggesting is, since you are kind enough to listen to us, isn't it? So you can, in river guidance, we can work. Otherwise, it goes parallelly means I don't think we will be able to. See, even these drugs which are proven only on cancer cell lines, not on human beings. So on human beings, again, the modern people he does only with one drug, one herb. So that is not a complete treatment, isn't
Yeah.
it? Yeah.
Definitely, I've picked up some take-home messages with respect to what information I wanted to gather from your specialty. So now, to bring it to action, I over a period of for the past few days, I've been coordinating with Dr. Neelkant, and in this session, we have been able to interact. I do carry some take-home message. Ultimately, your specialty, our specialty, should work for the patient's benefit.
Betterment, yeah. Prajanugraha kamyaya, that is only our goal ultimately.
Yes.
So we shall keep our knowledge parallel, but club both the knowledge, plan it together. I think we must try somewhere. It happens definitely. I'm sure of it.
Yeah.
Yeah.
We have to work,
Yeah.
move
Thank
forward.
you so
Dr.
much.
Rajeshri, your comment? Yes.
Yes, madam. You have said everything. See, what I see is some of our friends who have done BAMS, I have, like my patients, when they find time, they go to Ayurvedic doctors or homeopathic doctors. I've seen prescriptions of our allopathic medicines being prescribed
Yeah.
also.
That is a debatable one. And let us not talk about it. I am taking pure Ayurvedic lines we will give, and you help us. So both of us jointly will try to work. It is a long-term strategy.
Madam, some of them do prescribe allopathy medicines, isn't it? Our
Yeah.
We are
BMS
integrated
doctors.
doctors. Doctor, 1 second.
Some of them are integrated.
We are
Without that,
integrated
in
doctors.
rural
We have
areas,
practiced,
people
we
also
have-
give allopathic
Yeah,
medicines.
we have trained in modern science from Bangalore Medical College. That course is not there now. That we are all above 60s now. So that course is stopped. We are the doctors who can prescribe Ayurveda and allopathy both. We have done BMS 5.5 years. Now it is not there. BMS 1.5. Total we have studied for 7.5 years. So I am in that.
No, that's okay. You're contemporaries, but others, how do we differentiate? You don't know, no?
We don't also. We also don't know. That's what Madam is
No,
telling.
that is because, see, our people, during housemanship itself, your nursing homes admit them as employees. So they train them. They feel it is easier because practicing Ayurveda is little difficult. This is easier because you send them for an investigation, diagnosis is made easy, then treatment, you know very well, you have a definite protocol. It's not so with us. So we have hundreds of choices. That is sometimes a boon, sometimes a problem. Isn't it? So if what I give, I don't agree with the other's prescription. So this type of things are there. So that they are all debatable. But above all, Ayurveda has its own principles and a holistic approach. So that if we keep in mind, definitely we can do something. That's
No,
my concern.
100%. See, being a Hindu, being brought up in India,
Because I never practiced allopathy because I didn't even do that additional course.
No, certainly.
I never practiced.
We, at least Dr. Rajeshri, I don't just prescribe. I tell my patients, only writing tablets is very easy. No, I don't rely only on the tablets, the lifestyle, the diet,
Yeah.
everything I depend. So certainly whatever message you gave has been definitely an addition to my knowledge about Ayurveda specialty. It goes without saying. But I'm always searching for how better you and me could work. So I did carry a few more messages from you so that I can work on that, both at the branch level, state level, as well as at the national level. So this message I am going to carry. I did.
Thank you
Uh,
so much.
FPA people approached me to speak about the vaccine, so I did speak to my seniors in IMA and said that we are allopathy doctors. Am I entitled to speak to them? Then I also said, look, I speak to the public, I speak to everybody about HPV vaccination. So the answer from the other side also was the same. You are transmitting information about the vaccine to anybody and everybody. So we are entitled to it. So working with you today definitely has been a good eye opener, and definitely it has paved the path for how better to work for the good of the patient.
Yes.
Isn't it?
Thank you
Yes.
so much, madam. I'm so happy. Our youngsters are very good, really. I'm 70 plus, so it's a time to relax. But I love all my children. That's why I was talking to them before starting the session. Thank you
No,
so
no,
much.
age is not the criteria. As long as your health permits, as long as your mind permits, I think we have to be of use to our
Yeah.
youngsters.
Yeah.
I'm also 66.
Very good.
Mhm.
Yes, I think Amrita, you can conclude.
Amrita, take
Yes,
it over.
ma'am. Before we get into our final segment, I have a quick announcement. The Family Planning Association of India welcomes members to get involved in the programs and activities. If anyone is interested in joining, you can enroll as a member by paying an annual subscription of rupees 500. Now, I'd like to take the privilege of saying the vote of thanks on behalf of Tribhuvan Foundation. First, a big thank you to our speaker, Dr. Anuradha Paramesh ma'am, for such an enlightening session. Our sincere thanks to our leaders, President Dr. K.S. Jayashree ma'am, Secretary Dr. G.S. Gopal Krishna sir, Joint Secretary Dr. Neelkant J. Sajjanar sir for making this event possible. Thank you Dr. Rajashri ma'am, Dr. Gayatri, Dr. Chandrakala for your support tonight. We are deeply grateful to our senior doctor experts and dignitaries who joined the session. Dr. Sundari, senior OB and gynecologist, Srimati Rekha madam, Srimati Indira ma'am, from FPA Bengaluru, Dr. Anjanaya Murthy sir, former JD Government of Karnataka, Dr. Aruna ma'am, former principal GAMC Mysuru, Dr. Tripathi sir, Dr. Chakravarti sir, Dr. ARV Murthy sir for their valued presence. Our heartfelt thanks to Dr. Rudragaudar sir, Vice President of Tribhuvan Foundation, Shri Kumar sir, Treasurer of Tribhuvan Foundation, for their continuous engagement and guidance. I extend my gratitude to Shri Harishnath sir for providing seamless backup and technical support throughout the online session. And my humble pranams and gratitude to all members of Yojaka Samiti for their wonderful support and organizing and conduction of this webinar. Finally, thanking all the doctors, scholars, participants in the audience for joining us and making this webinar a success. Wishing everyone Shubhratri, Jai Hind.
Thank you.
Thank you,
Thank
Amrita,
you.
for a very nice
Thank you,
coordination throughout the session. Thank you very much.
Thank you.
It was
Thank you,
great.
Anuradha
It
ma'am.
was
Nice
great.
meeting you, madam.
It was
Same,
great
same.
interacting
Meet
with all
again.
of you.
Same.
Thank
Thank
you,
We'll take it
madam.
forward
Good night.
for fruitful tomorrow.
Yes. Thank
Thank
you.
you.
Thank you.
Yeah. Yes, ma'am.
Yes, sir. ಏನ್ ಸಮಾಚಾರ
Discussion ಆಯ್ತು.
ಮುಗಿತಾ ಚೆನ್ನಾಗಾಯ್ತಲ್ಲ
Ma'am.
ಮ್ಯಾಮ್ ಒಂದು ತಪ್ಪಾಯ್ತು ನನ್ನ ಕಡೆಯಿಂದ ಕ್ಷಮಿಸಿ.
ಏನಾಯ್ತಮ್ಮ
ನಾನು
ಏನ್
Q&A
ತಪ್ಪಾಯ್ತು?
ಸೆಷನ್ ಹೋಗೋ ಬದಲು ನಿಮ್ದು ಸ್ಕಿಪ್
Okay.
ಮಾಡಿ ವೋಟ್ ಆಫ್ ಥ್ಯಾಂಕ್ಸಿಗೆ ಹೊಟ್ಟೋಗ್ತಾ ಇದ್ದೆ, ಕ್ಷಮಿಸಿ.
ಕರಿತಾ ಇದ್ರ ಮನೇಲಿ
ಹಾ?
ಮನೇಲಿ ಕರಿತಾ ಇದಾರ
ಇಲ್ಲ, ಸರ್ ಟೈಮ್ ನೋಡ್ತಿರ್ತಾರೆ. ಸರ್ ಇಸ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಅಬೌಟ್ ಟೈಮ್, ಅದು ಹೇಳ್ಕೊಟ್ಟಿದ್ದಾರೆ PG ಅಲ್ಲಿ ಪರ್ಫೆಕ್ಟ್ ಆಗಿರ್ಬೇಕು ಅಂತ.
Very
ಅದ್ರಲ್ಲಿ
good.
ಮಾಡಕ್ ಹೋಗಿ ಒಂದು ಮಿಸ್ಟೇಕ್ ಆಯ್ತು, ಕ್ಷಮಿಸಿ ಮ್ಯಾಮ್.
No. It was very good. And your speaking was very clear, musical. ಖುಷಿ ಆಯ್ತು. Thank you so much. ಗಾಯತ್ರಿ ಇದಾರ? ಗಾಯತ್ರಿ ಚೆನ್ನೈ
ಇಲ್ಲ ಮ್ಯಾಮ್, ಹೊರಗಿದ್ದಾರೆ ಅಂತ ಅವರು.
ಹೋಗ್ಬಿಟ್ರಾ? ಹಾಡಿದ ತಕ್ಷಣ ಹೊಟ್ಬಿಟ್ರು. ಇನ್ಯಾರಿದ್ದಾರೆ?
ಶ್ರೀನಿವಾಸ್ ಇದಾರೆ,
ಶ್ರೀನಿವಾಸ್, ಚಂದ್ರಕಲಾ ಮೇಡಮ್,
ಶ್ರೀನಿವಾಸ್ ವೈದ್ಯ,
ನಮ್ ಪ್ರಜೆಗಳು
ನಮ್ಮ ತ್ರಿಪಾಠಿ ಇದ್ದಾರೆ,
ನಿಮ್ ಪ್ರಜೆಗಳು
ಅಲ್ವಾ?
ನಂದ ಇದ್ದಾರೆ.
ಏನ್ ಗೊತ್ತಾ, ತುಂಬಾ ಇನ್ನರ್ ಸರ್ಕಲ್, ಔಟರ್ ಸರ್ಕಲ್, ಆಮೇಲೆ ಟರ್ಷಿಯರಿ ಎಲ್ಲ ಬರ್ಬೇಕಲ್ವಾ?
ಅಲ್ಲ, ನಂದ ಇದ್ದಾರೆ.
ಏನೋ ಕ್ವಶನ್
ನಂದ ಕಾರ್ಕಳದಿಂದ ಇದ್ದಾರೆ.
ಟೈಮ್ಗೋಸ್ಕರ ನಾವು ತೊಗೊಳಕ್ ಆಗ್ಲಿಲ್ಲ. ನಂದಾ ಮೇಡಮ್ ಏನಾರು ಹೇಳ್ಬೇಕಿತ್ತ?
ಏನು ಇಲ್ಲ ಇದ್ದಾರೆ, ಏನಾರು ಹೇಳ್ಬೇಕಿತ್ತ? ಇಲ್ಲ. ನಂದ
ಹ್ಯಾಂಡ್ಸ್ ರೈಸ್ ಮಾಡಿದ್ರು.
ಹೌದು,
ಏನಮ್ಮ?
I have treated few fibroid cases. ಕರ್ಗೋಗಿವೆ ಪೂರ್ತಿ. ಇತ್ತೀಚೆಗೆ ಗೋಪಾಲ್ ಕೃಷ್ಣ ನೋಸ್ ಇಟ್. ನಾನು ಹೇಳಿದ್ದು ಗೋಪಾಲ್ ಕೃಷ್ಣ ಅವ್ರ ಹತ್ರ. ಒಂದು ಐ ವಾಸ್ ಟ್ರೀಟಿಂಗ್
ಅಂತದನ್ನ ಚಿಕ್ಕದನ್ನ ಒಂಚೂರು ಶೇರ್ ಮಾಡೋದ್ ತಾನೆ ಗ್ರೂಪ್ ಅಲ್ಲಿ
ಶೇರ್ ಮಾಡೋ ಗ್ರೂಪ್ ನೋಡೋದು ಕಷ್ಟ ಆಗ್ಬಿಟ್ಟಿದೆ ಮೇಡಮ್.
ನೋಡ್ಬೇಕಪ್ಪ, ವಾರಕ್ಕೆ ಒಂದ್ಸಲ ನೋಡೋಕ್ ಇಟ್ಕೋಬೇಕು. ಹಾಗಾಗಿ ನೋಡಿ, ಹೊರಗಿನವರೇ ಜಾಸ್ತಿ ಸಿಗ್ತಾರೆ ನಮ್ಮ ಮೆಂಬರ್ಸ್.
2 ಕ್ಯಾನ್ಸರ್ ಕೂಡ ಆಯುರ್ವೇದಿಕ್ ಪೇನಲ್ಲೇ ಟ್ರೀಟ್ ಮಾಡಿ ಒಂದಂತೂ ಪೂರ್ತಿ ಗುಣ ಆಗಿದೆ, ವಿತ್ ಆಯುರ್ವೇದಿಕ್ ಮೆಡಿಸಿನ್ಸ್. ಯೂಟ್ರೈನ್ ಕ್ಯಾನ್ಸರ್
ಏನಾಗುತ್ತೆ ಗೊತ್ತಾ, ನಾವು ಒಂದ್ ಮಾಡಿದ್ವಿ ಅಂತ ಅವ್ರಿಗೆ ಹೇಳಿದ್ರೆ ದೇ ಡೋಂಟ್ ಅಕ್ಸೆಪ್ಟ್ ಇಟ್.
ಪರವಾಗಿಲ್ಲ.
ನೀನು ಪ್ರಾಕ್ಟಿಷನರ್ ಆಗಿ ನೀನು ಪ್ರಾಕ್ಟಿಷನರ್ ಆಗಿ ಯೋಚನೆ ಮಾಡ್ತಿದೀಯಾ, ನಾವು ಕಮ್ಯುನಿಟಿ ಲೆವೆಲ್ ಯೋಚನೆ ಮಾಡ್ಬೇಕು.
ಅಲ್ಲ ಸರಿ, ಎಲ್ಲ ಜರ್ನಿನು ಸ್ಟಾರ್ಟ್ಸ್ ವಿತ್ ಫಸ್ಟ್ ಸ್ಟೆಪ್ ಓನ್ಲಿ. ನೋ,
ಇಲ್ಲ ಹಂಗಲ್ಲ. ಏನಾಗತ್ತೆ ಗೊತ್ತಾ, ನಮ್ಮಲ್ಲಿ ಆತರ ಬೇಕಾದಷ್ಟು ಜನ ಇದ್ದಾರೆ. ಯು ಸಿ ದ ನೆಟ್, ಎಷ್ಟು ಕೇಸಸ್ ಟ್ರೀಟ್ ಮಾಡಿರೋದು ಇದೆ.
ನಮ್ಮ ಡಾಕ್ಟರ್ ಮೋಹನ್ ಆಳ್ವಾ, he has treated sarcoma years back, 30 ವರ್ಷದ ಹಿಂದೆ.
ನಾನ್ CA ಸರ್ವಿಕ್ಸ್ ಕೇಸ್ ಸ್ಟಡಿ ತಗೊಂಡಿದ್ದೆ 22 ವರ್ಷದಿಂದ.
ನೀವು ಹೇಳಿದ್ದು ಮಾತ್ರ ಬಹಳ ಚೆನ್ನಾಗಾಯ್ತು ಮೇಡಮ್. ಐ ರಿಯಲಿ ಅಪ್ರಿಶಿಯೇಟ್.
ವಾಟ್ ಐ ಸೇ ಈಸ್, ನಾವು ಒಂದೊಂದು ಮಾಡೋದನ್ನ ಲೆಕ್ಕ ಇಡಕ. ಅದಕ್ಕೆ ನನ್ಗೆ ಹೇಳಿದೆ, ಐ ಆಮ್ ವೆರಿ ಪರ್ಟಿಕ್ಯುಲರ್ ಅಬೌಟ್ ಮಾನಿಟರಿಂಗ್.
ಹೌದು,
ಯಾಕಂದ್ರೆ ನಾನು ಸ್ಟೂಡೆಂಟ್ ಆಗಿರೋ, ನಾವು ಹೌಸ್ ಸರ್ಜನ್ಸ್ ಇಲ್ಲ ಇದ್ದಾಗ ಡೈರೆಕ್ಟ್ ಸ್ಪೆಷಲ್ ಪರ್ಮಿಷನ್ ತಗೊಂಡು ಒಂದು ಕೇಸ್ನ ಅಡ್ಮಿಟ್ ಮಾಡಿದ್ರು ನಮ್ಮ ಸ್ಪೆಷಲ್ ವಾರ್ಡ್ ಅಲ್ಲಿ ಬೆಂಗಳೂರು. ಅಂಡ್ ದೇ ವರ್ ಟೆಲಿಂಗ್ ಈಸ್ ಟ್ರೀಟಿಂಗ್ ಕ್ಯಾನ್ಸರ್ ಕೇಸ್, ಯೂಟ್ರೈನ್ ಕ್ಯಾನ್ಸರ್ ಅಂತೆಲ್ಲ ಹೇಳಿದ್ರು ಅವಾಗ. ಆಮೇಲೆ ನಾವು ಹಿಸ್ಟ್ರಿ, ನಮ್ಗೆ ತುಂಬಾ ಇರುತ್ತಲ್ವಾ ಆಂಗ್ಸೈಟಿ ಕಳಿಬೇಕು ಅಂತ. ಸೊ ಯು ವೆಂಟ್ ಟು ಟೇಕ್ ದ ಹಿಸ್ಟ್ರಿ. ನೋಡಿದ್ರೆ ಅದು ಹಿಸ್ಟ್ರೆಕ್ಟಮಿನೇ ಆಗ್ಬಿಟ್ಟಿದೆ. ಇವ್ರು ಇನ್ನೇನು ಯೂಟ್ರೈನ್ ಕ್ಯಾನ್ಸರ್ ಟ್ರೀಟ್ ಮಾಡೋದು.
ನಾನು ಸೇಂಟ್ ಜಾನ್ಸ್ ಅಲ್ಲಿ ಮಾನಿಟರ್ ಮಾಡಿಸಿದ್ದೀನಿ ಅದನ್ನ, ಬೆಂಗಳೂರು.
ಅದನ್ನ ನೀನು ಪಬ್ಲಿಷ್ ಮಾಡ್ಬೇಕಪ್ಪ.
ಇದೆ ನನ್ನ ಹತ್ರ ಎಲ್ಲ ರೆಕಾರ್ಡ್ಸ್.
ನಿನ್ನ ಹತ್ರ ಇದ್ರೆ ಏನ್ ಮಾಡು, ಉಪ್ಪಿನಕಾಯಿ ಹಾಕ್ತೀಯಾ? ಪಬ್ಲಿಷ್ ಮಾಡು. ಇವ್ರನ್ನ ಕೇಳು, ನಮ್ಮ ನೀಲಕಂಠ ಇವ್ರಿಗೆಲ್ಲ, ಚಂದ್ರಕಲಾ, ಮಮತಾ ಇವ್ರಿಗೆಲ್ಲ ಹೆಂಗ್ ಬರಿಬೇಕು ಪೇಪರ್ ಅಂತ ಹೇಳ್ಕೊಡ್ತಾರೆ.
ಅಷ್ಟೇ, ಈ ಟಾಪಿಕ್ ಅಲ್ಲಿ ಅದು ಬೇಕಾಗಿರ್ಲಿಲ್ಲ. ದಿಸ್ ವಾಸ್ ಎಂಟೈರ್ಲಿ ಡಿಫರೆಂಟ್ ಅಲ್ಲ ಇವತ್ತಿದ್ದು.
ಹೇಳಿದ್ದಕ್ಕೆ ಜಸ್ಟ್ ಫಾರ್
ಶೇರಿಂಗ್ ಅವರ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಸಿಕ್ಕಿದಾಳಲ್ಲ ಅಷ್ಟೇ.
ಅಲ್ಲ, ಇಲ್ಲಲ್ಲ, ಅವ್ರ ಹತ್ರಕ್ಕೆ ಎತ್ತಿದ್ರೆ ಅಂತಂದ್ರಲ್ಲ.
ಮೇಡಮ್ ನೋಡಿ, ಹಾಗೆ ಅಲ್ಲ, ರಸಾಯನ ಶೋಧನ ಅದೆಲ್ಲ ಹೇಳಿದ್ರಲ್ವಾ, ಅದಕ್ಕೋಸ್ಕರ ಅದಕ್ಕೊಂದು ಸಪೋರ್ಟಿಂಗ್ ಪಾಯಿಂಟ್ ಆಗಿ ಹೇಳಬೇಕು ಅಂತ.
ನಾನು ಬೇಕಂತಲೇ ನಾನು ಹೇಳಿಲ್ಲ ಸರ್ವಿಕಲ್ ಕ್ಯಾನ್ಸರ್ದು. ಅದೇನಾಗತ್ತೆ, ನಮ್ಮದು ನಾವು ಮಾನಿಟರಿಂಗ್ ಕಿದ್ವಾಯ್ನವ್ರು ಮಾಡಿದ್ದು ನಮ್ಮ ಕೇಸಸ್ನ. ಸೊ ನಾನೇ ಹೇಳೋದೇನ್ ಗೊತ್ತಾ, ಲೆಟ್ ಅಸ್ ಗೋ ಮೆಥಾಡಿಕಲಿ. ಎಷ್ಟು ಟ್ಯಾಕ್ಟ್ಫುಲ್ ಆಗಿ ಹೇಳಿದ್ರೆ ನೋಡು, ನಿಮ್ಮವರು ಅಲೋಪತಿಕ್ ಮೆಡಿಸಿನ್ ಬರೀತಾರೆ ಅಂತ. ಇಟ್ ವಾಸ್ ಸೋ ಡಿಸ್ಗ್ರೇಸ್ಫುಲ್ ಅಲ್ವಾ?
ಆದ್ರೆ ನನ್ಗೆ ಫೋನ್ ಬಂದಿದೆ,
ವೆರಿ ಗುಡ್
ಅಂತದ್ದು ಕೇಸಸ್ ಸಿಕ್ಕಿದ್ರೆ, ಅಂದ್ರೆ ಇಟ್ ವಾಸ್ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಕೇಸಸ್ ಟ್ರೀಟ್ ಮಾಡಿದೀರಾ ಮೇಡಮ್ ನೀವು ಅಂತ. ದಿಸ್ ಈಸ್ ದ ಫಸ್ಟ್ ಅಂತ ಹೇಳಿದೆ. ಸಪೋಸ್ ವಿ ಗೆಟ್ ದ ಕೇಸಸ್, ತುಂಬಾ ವೆರಿ ರೇರ್ ಕೊರಿಯಾನಿಕ್ ಕ್ಯಾನ್ಸರ್. ಸಪೋಸ್ ಇಂಥ ಕೇಸಸ್ ಬಂದ್ರೆ ನಿಮ್ಮಲ್ಲಿ ಕಳಿಸಬಹುದಾ ಅಂತ ಕೇಳಿದ್ರು. ನಾನು ಹೇಳಿದೆ, ಕಳಿಸಿದ್ರೆ ಐ ಕ್ಯಾನ್ ಟ್ರೀಟ್ ದೌಟ್ ಪೇಷಂಟ್ಸ್, ಬಟ್ ಯು ಹ್ಯಾವ್ ಟು ಮಾನಿಟರ್ ಅಂತ ಹೇಳಿದೆ. ಒಪ್ಪಿದ್ದಾರೆ.
ನಮ್ದು ಸುಮ್ಮನೆ ನಾವು ತುಂಬಾ ಸೂಪರ್ಫಿಷಿಯಲ್ ಆಗಿ ಎಲ್ಲದಕ್ಕೂ ದೋಷ ಗುಣ ಅಂತ ಹೇಳ್ಬಿಟ್ಬಿಡ್ತೀವಿ. ಆ ಗುಣನ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಲ್ಲ.
ಖಂಡಿತ. ದಟ್ ತ್ರಿದೋಷ ಗ್ರಂಥಿಗಳನ್ನ ಏನ್ ಹೇಳಿದ್ದಾರೆ ಅದು ಹಾಗೆ ಇರುತ್ತೆ ಪ್ರೆಸೆಂಟೇಶನ್.
ಈಗ ಕ್ಯಾನ್ಸರ್ ಒಂದ್ ಸಿಂಗಲ್ ದೋಷಕ್ಕೆ ಆಗೋದೇ ಇಲ್ಲ. ಕ್ಯಾನ್ಸರ್ ತ್ರಿದೋಷ ಅಲ್ಲೇನಮ್ಮ ಚಂದ್ರಕಲಾ?
ಹಾ ಮೇಡಮ್,
ಸಿಂಗಲ್ ದೋಷಕ್ಕೆ ಆಗಲ್ಲ ಅದು.
ಇಲ್ಲ, ತ್ರಿದೋಷ ಅಂತಾನೆ ತಗೋಬೇಕಾಗತ್ತೆ. ಸನ್ನಿಪಾತ
ನೀಲ್ಕಂಠ್ ಸರ್,
ಸನ್ನಿಪಾತ
ರೇಖಾ ಜಿ ಅಂದ್ರೆ ಇವರ FP ಅವರ?
ರೇಖಾ ಮೇಡಮ್ ಅವರೇನೆ, ರೇಖಾಜಿ.
ರೇಖಾ ಜಿ ಅಲ್ವಾ? ರೇಖಾ ಮೇಡಮ್
ಅವರು ಮೋಸ್ಟ್ಲಿ ಪ್ರೋಗ್ರಾಮ್ ಅಲ್ಲಿ ಇದ್ದಾರೆ, ಲಾಗಿನ್ ಆಗಿದ್ದಾರೆ ಅಷ್ಟೇ.
ಅಷ್ಟೇ.
ಸರಿ ಸರಿ, ಹಾಗಿದ್ರೆ ಚಿಂತೆ ಇಲ್ಲ ಬಿಡಿ.
ಅಲ್ಲ, ರಾವ್ಸ್ ಅಟೆಂಡ್ ಮಾಡೋರು ಮ್ಯಾಕ್ಸಿಮಮ್ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆನೇ ಮಾತಾಡ್ತಾರಲ್ಲ, ದೇ ಹ್ಯಾವ್ ಟು ಗಿವ್ ಇನ್ಪುಟ್ಸ್.
ಅಲ್ಲ, ಏನಾಗಿದೆ ಗೊತ್ತೇ, ದೇರ್ ಆರ್ ಪೀಪಲ್ ಹು ಆರ್ ಟ್ರೀಟಿಂಗ್, ನೋ ಡೌಟ್, ಬಟ್ ಅದು ಎಲ್ಲೋ ಒಂದ್ ಕಡೆ ಮಿಸ್ ಆಗ್ತಾ ಇದೆ. ಆಮೇಲೆ
ಈಗ ಬರ್ನಿಂಗ್ ಕ್ವಶನ್ ಮ್ಯಾಮ್, ಡೈರೆಕ್ಟ್ ಕ್ವಶನ್. If a lady comes with a cancer diagnosed case, should we treat or should we not treat? Only direct question, direct answer.
Speaking, you are not supposed to treat. ಯಾವುದು ಇದ್ರ ಪ್ರಕಾರ, ಮಾಡರ್ನ್ ಪ್ರೋಟೋಕಾಲ್ ಪ್ರಕಾರ, even tuberculosis case also you are not supposed. ಈಗ ನ್ಯಾಷನಲ್ ಡಿಸೀಸ್ ಅಂತ ಹಾಕೊಂಡಿದ್ದಾರೆ.
ಹೌದು.
So if it comes under that list, you are not, they should be registered. Every case has to be registered.
How can we say that we are treating or we can treat?
ಅದಕ್ಕೆ ನಾನು ಹೇಳಿದ್ದು, ಅದಕ್ಕೆ ಬೆಲೆ ಬರೋದಿಲ್ಲ. You have to, your claims is not accepted at a proper level.